we're gonna look at the Berg Balance Test. So the first item of the 14 items is gonna be sit to stand. So they're gonna go from seated position in a sturdy chair to standing without pushing off with their arms. So at least I want you to stand up without pushing off with your arms at all. Good. And then we record our score. The next one is going to be stand unsupported for 2 minutes. So I just say, okay, I'm going to time you. I just want you to stand there, okay? And we're going to make sure we're guarding and go. And we would go for 2 minutes and stop. And then that would be that one. If they can do that one, then we don't have to do the third item. But the third item is going to be sit unsupported with feet on the floor. So Alicia, will you have a seat for me? Or make sure their back is off of the chair. Again, the chair is sturdy, not going to tip over. And again, we're going to do that for 2 minutes. So, okay, ready? And go. And we would time that and record our score. The next one would be stand to sit. So, I'm sorry, can we have you stand again? So, again, if they had the ability to do the second one, we wouldn't have to do the third, and they could go straight from standing to sitting. So, we would record how they do that. So, go ahead. Right? And then we record how they do that. So, minimum hand use, we would get a 4 for that one. Then we would do a transfer. So, we would sit up. 2 chairs, one with armrest, one without, at 90 degrees, for them to do a stand and pivot transfer. So I would say, Alicia, I want you to stand up, and I want you to turn and sit down into this chair, and then I want you to get up, stand, and turn, and sit down in this chair, okay? All right, so go ahead. And again, I'm guarding, I'm watching. Okay, go ahead again. Right, there we go. And so for that one, we're also looking for hand use, and we record our score. The next one is going to be stand unsupported with your eyes closed. So can I have you stand up for me? So I would just have her close her eyes, and we're going to try to stand for 10 seconds. So I would get my timer, and I would say, all right, close your eyes and go. I would time, guarding, making sure they're not going to fall over. Good, you can open your eyes. Next would be stand unsupported with the feet together. So can you bring both your feet to touch? There you go. And again, we would time for 1 minute. And you're good, and we're guarding. The next one is going to be reach forward with an outstretched arm. So we need a ruler for this one. Have it over here. What we're going to have the patient do is standing. And I'm going to have you put your arm up like this, okay? And I'm going to hold a ruler up where they first start. And I want you to lean forward as far as you can and reach that arm out for me, okay? And I would record the distance that they go. Again, guarding the whole time. The next one is going to be pick up an object from the floor. So I would take something like this water bottle, something steady. It recommends a shoe or a slipper. And then I would say, okay, Alicia, I want you to bend over and pick up that water bottle. Okay? And then we would record our score for that one based on our test. The next one is going to be turn to look over left and right shoulders. So I would just have them, I would say, Alicia, I want you to turn your head and look over your left shoulder. I want you to turn and look over your right. Good. And so again, we make sure they're weight shifting well as they're rotating, nothing throws them off, guarding them. Next, we would do turn 360. So I will have them turn in 360 degrees to one side, and then stop and pause, and then turn 360 to the other side, okay? All right, so go ahead. Good. And for this one, we're timing. Next would be the step test, the stool stepping. So we would have them alternate feet, getting them up onto the stool while we time. We want to get 8 steps in 20 seconds. And that would be a 4. So we'd say, go ahead. Good. Time. And we go 20 seconds and stop. Go ahead. And we record the score for that one. So after stool stepping, we're going to have tandem standing. So we want to hold this for 30 seconds. We would instruct them to put one foot in front of the other, toe touching. If they can't touch their toes, we would just have them step as far forward, trying to clear that heel in front of the toes. And so then again, we'd hold for 30 seconds. And good. Stop. Again, guarding our patient. And then the last one is stand on one leg, and we want greater than 10 seconds to go for. So we'd say, all right, go ahead and sit on one leg and go. We would time. And good. Relax. So these are going to be our 14 items for the Berg Balance Test. This test requires very little material and can be done in a variety of spaces, whereas something like the functional gait assessment needs more materials, it's more complex, and it's got more complex motions. This test has more simple motions that are very functional, and for that reason we would pick it over something like the mini best due to its functionality. It's also better than something like the tug because it gives us more specific look at balance throughout multiple activities.